Hello everyone, I am Dr. Rajesh Mishra and the head of the Department of Critical Care Medicine out here. Okay, and today we are going to discuss about basic life support. Okay, so basic life support, is everyone aware what is basic life support? Let me just elaborate it. Our heart, approximately, it beats some 40 million times a year. Okay, so that's a huge amount, 40 million times a year, and it pumps almost like 7,500 liters of blood in a day. So that's a huge amount. Okay, so our heart is endowed with that task that it does this massive work of perfusing each and every organ in your body. But there is one exception, the cornea. Okay, a part of cornea, the heart perfuses each and every organ of your body. And the basic purpose of basic life support is to continue the perfusion of each and every organ of the body. Okay, so whenever a patient falls down unconscious, unresponsive, not able to take breath, and the heart stops, what appropriate steps you would like to take so that the patient life is saved? Okay, this class is purely based on the recommendations as recommended by American Heart Association 2020. Okay, so as per the American Heart Association guidelines of 2020, we call it the AHA 2020 guidelines, we have two types of cardiac arrest. One is in-hospital cardiac arrest, the other is out-of-hospital cardiac arrest. Okay, here, considering the type of population we have, we are more concerned with in-hospital cardiac arrest because this is a hospital setting. But I think each and every one of you must also be aware that what do we do in a out-of-hospital cardiac arrest? Supposedly you are walking in a mall, a person falls down, you have to save the patient, right? If you are in a movie theater and one of the person falls down, you have to support him. So this is the funda of basic life support. As we know, our country, India, is staggered behind the Western world by a significant period of time. We need to accelerate so that we catch up with the rest of the world. Okay, and in the Western countries, even the bus conductor knows the basic life support. So don't think that you need to have a degree of graduation or post-graduation to know the basic life support. An uneducated bus conductor can actually perform a basic life support. So you all people are highly literate to do a basic life support. Okay, anyone in this crowd, in this audience who are feeling that I am not the person to give basic life support, I would tell you very clearly, in Western countries, bus driver and bus conductor give excellent basic life supports. Excellent. Okay, so you should be confident that okay, you will be able to give the support. Fine. So American Heart Association, what they have done is they have explained certain chains of survival. Okay, the chain of survival, that means what are the steps in which you have to proceed so as to complete the basic life support. Okay, so firstly we'll just discuss about the in-hospital cardiac arrest. Okay, so in hospital cardiac arrest, the first thing that you need to do in the chain of survival is early recognition. Early recognition of what? That the patient had a cardiac arrest. Okay, or the patient is not breathing, or the patient heart is not beating, in simple language. Okay, first you have to make sure this thing that the patient has fallen down and the patient's heart is not beating and the patient is not breathing. This is called early recognition. Okay, once you recognize that a person has fallen down because his heart is not beating or he is not breathing, then what you do is the emergency response services activation. Okay, what is ERS? What is emergency response system activation? As we all do in hospital setting, we announce a code blue, right? This is called the emergency response system activation. Supposedly you are in a mall. How do you activate the emergency response system? What you do is you take out your phone, call 911 and tell them there is a person who has just fallen down, please send the emergency response services. Okay, every state has got its own code and that code has to be dialed by a phone so that the emergency response team arrives to the spot as early as possible. So early recognition. Second is the ERS activation. Once you recognize, you activate the emergency response system. Okay. The third thing is you start an early CPR, high quality chest compressions. Okay. What is high quality chest compression? Any chest compression which is of the rate of 100 to 120 per minute. Okay. And a depth of 4 to 5 centimeters. Okay. And a compression is to ventilation ratio of 30:2 in adults is called a high quality CPR. So there are three things. One, rate. What is the rate? 100 to 120 per minute. One is the depth. At least 5 centimeter. 5 to 6 centimeter is optimal. Previously it was 3 to 5 centimeters. You must know around 5 centimeter. Okay. So it has to be 5 to 6 centimeter in depth, and compression is to ventilation ratio should be 30:2. For pediatric patient is 15:2. Okay. But even in pediatric patient, if you are single rescuer, you don't have any extra rescuer person associated with you, you can give a 30:2 compression ventilation ratio even in pediatric patient. Okay. So this is it. So high quality CPR, compression rate 100 to 120, compression depth 5 to 6 centimeters, and compression is to ventilation ratio should be 30:2. Make it very simple. Okay. Fine. So CPR. Third thing is the defibrillation. Okay. After CPR is the defibrillation. What is a defibrillator? In the practicals we will see automated external defibrillator. An automated external defibrillator is a small box like instrument which is capable of guiding your CPR as well as delivering shock at appropriate time. Okay. So an AED is an automated external defibrillator that is available nowadays in every metro station, in every railway station, at every airport, at every big malls you will get an AED. Okay. You have to get the AED as soon as possible and then attach it on the patient's. One should be at the sternal area and the other should be in the apical area of the heart. Okay. The one pad should lie just below the collarbone and the other lie at the just above the heart, so that the electricity flow across the heart. Okay. That is defibrillator. We'll get into the details of defibrillator. Then you have something called a post cardiac arrest care. Okay. In an hospital, once you resuscitate a patient who has fallen down because his heart is not beating or he is not taking breath, and you have rescued the patient after giving high quality CPR and defibrillation, what you should do is post cardiac arrest care. Post cardiac arrest care involves various things like maintenance of a definite airway, like intubation, mechanical ventilation, and cooling of the patient. Supposedly the CPR went for more than 30 minutes. So you should cool down the patient, cool down to hypothermia. Okay. Cool down to almost like 35 to 37 degrees. These are all post cardiac arrest care. And you should protect all the neuroprotective measures. There are various neuroprotective measures. Get down the intracranial pressures down, get a definite airway, and also get any exaggregating factor which is increasing the intracranial pressures on a lower level. Then there is recovery. Okay. So this is the chain of survival in an in-hospital cardiac arrest. The first thing is recognition. The second thing is activation of the emergency response team. Third, high quality CPR. Fourth, defibrillation. Fifth, post cardiac arrest care. Sixth is recovery. These are the 6 steps in the chain of survival of in-hospital cardiac arrest that occurs in any of the patients. Fine. We are in hospital. Supposedly you encounter with a similar scenario in an out of hospital cardiac arrest. The first thing that you are going to do in an out of hospital cardiac arrest is ERS activation. Okay. In hospital cardiac arrest, what will the recognition? But in out of hospital cardiac arrest, the first thing that you are going to do is emergency response system activation, because you are out of the hospital. You can't do much by only chest compressions. You have to get something for help of the patient. Okay. You have to get an automated external defibrillator. You have to get some airway devices. So whenever you encounter a similar scenario, you just use your mobile phone, dial 911, 198 or whatever is the local state code, local city code for emergency response system. Okay. Even if you are in not aware of any services, you can just dial any emergency number. Nowadays, most of the mobile phones would give emergency numbers. Okay. Which are inbuilt in your mobiles. You can just call any emergency mobile to get a medical aid. But all of us should know the emergency numbers. Definitely is 198 or 911. Okay. And whenever you see an out of hospital cardiac arrest, the chain of survival is like, first you have to call someone, ERS activation, then you have to go for CPR, then you have to go for defibrillation, as we just discussed. The third thing is, in this setting, when a patient gets a cardiac arrest outside, after these two things, what you have to do is advanced resuscitation, which is generally done in the ambulance services. Okay. And then comes the post cardiac arrest care as well as recovery. Okay. So there is slight difference in the chain of survival. As I told you, when it's an in-hospital cardiac arrest, the first thing in the chain of survival is identification. The second thing is calling the activation of the code. The third thing is CPR. Fourth thing is defibrillation, post cardiac arrest care and recovery. Whereas if you are in an out of hospital setting, the first thing that you are going to do is to call for help or ERS activation. Then you start the CPR, then start the defibrillation. Then one extra thing in the out of hospital care is advanced resuscitation, generally done in the ambulance services. Then the similar things of post cardiac arrest care and recovery. Okay, am I clear till this much? These are the two chain of survivals for in-hospital cardiac arrest and out-of-hospital cardiac arrest. Now coming to a little bit of details, like whenever you see a patient unresponsive, what's the first thing that you will do? Like, as we know, the chain of survival we just discussed, but you should, how do we check responsiveness? As simple as that. We'll see when we go towards the mannequin. First, whenever a person falls in front of you, okay, supposedly someone is sitting in the front desk, someone is maybe sitting in the ward, someone is sitting at home, and a person in front of you falls down. The first thing that you have to do is scene safety. Okay, supposedly you are at a mall and then a person falls down, you want to save the patient, but then there is a fire in the mall. You will endanger your life by saving him. So first, scene safety. That means you should remove that patient from that danger zone to a place where he can be safe. Okay, where he is safe and you are safe, and you can salvage the patient out. After the scene safety, what you have to do is you have to call 911, activate the emergency response team, and then just recognize what the patient has. See the patient tangentially, whether the patient is breathing or not. Okay, first you have to check the breathing. How do you check the breathing? See the chest of the patient. If it is rising, that means he is breathing. If it is not rising, that means he is not breathing. Well, then you check the pulse. How to check the pulse? Last time also I told, put your 3 fingers on the center of of your neck and above the trachea, and then glide it down laterally. You'll feel your pulse. See, everybody has to feel lightly. Just put it in the center and then glide it down. You'll feel your carotid pulse. So you check the pulse. Ideally, both these things has to be in synchrony. That you should check whether the patient is breathing and check the pulse. Supposedly, you find a pulse and the patient is breathing. What do? You just monitor the patient till the emergency response team comes. The second probability is that the patient is breathing, but the patient has got a pulse but he is not breathing. You can feel the pulse but he is not breathing. That means he has got a respiratory failure. In that, you will give only manual breaths. Okay, how to give will come into the details. So you give only manual breaths and wait for the emergency response team to come. The third probability is that the patient is not breathing, the patient does not have a pulse. What to do next? Start CPR. Okay, if you are accompanied by one person, tell them go and get the AED pads, or go and call someone for help who can be of some help to the patient and to us, and then start the CPR. How to do the chest compression? As I told you, 100 to 120 per minute, depth of at least 5 to 6 centimeters. What else? Compression is to ventilation ratio of 30:2. Fine. And as soon as the AED arrives, you have to place the pads, start the start the process, the AED machine tells you everything. We'll see how the AED machine works, and it will tell us almost everything, when it will deliver shock, when it will not deliver shock. There are two shockable rhythms. One is VF, the other is pulseless VT. Non-shockable rhythms is asystole and pulseless electrical activity. Okay? So whenever there is shockable rhythm, you need not to remember these things. Mind it. The machine will do everything for you. Okay? So the machine will recognize, the automated external defibrillator will recognize whether it is a shockable rhythm or non-shockable rhythm. What you have to do is you have to do effective chest compressions, and as the machine says, if it delivers shock, you just tell all clear, everybody should be out of the patient, and deliver the shock. Once the shock is delivered, you should resume the CPR as early as possible. Okay? And wait till the ambulance arrives, and once you resuscitate the patient, you can just shift the patient to ambulance, shift the patient to a hospital where the post cardiac arrest care and recovery can be done. Okay? So this is it. Compression is to ventilation ratio. How can you ventilate the patient? This is another aspect of BLS. How can you ventilate the patient? By ventilation, the first thing, if you don't have anything, mouth to mouth breathing. One is pocket mask breathing, which generally comes in the automated external defibrillator box. There's a mask where you can just pull in. We normally breathe at 21% oxygen is in the atmosphere, right? When you exhale 17% oxygen. So even that 17% oxygen can be life-saving for the patient. Okay, so you have to save the patient life. So if you can give mouth-to-mouth breathing, okay. If you can't give, you can use a pocket mask. I'm sure that none of us carries a pocket mask. What you can do is you can use any barrier method in between to give the patient mask. Even you can use your hand, put it over the patient mouth, and then just blow air with your mouth. Even that can save the patient. Okay, so this is the ventilation part. And then I will also explain how to ventilate with a mask. Okay, making a C shape and then giving 3 maneuvers. What are the 3 maneuvers? Jaw thrust, chin lift, and head tilt. Head tilt, chin lift, and jaw thrust. These are the 3 maneuvers that you should do while ventilating a patient. Okay, apart of that, you can use a mask, you can use a ambu, and then ventilate the patient. Till you can use advanced airway devices such as laryngeal mask airways or endotracheal tube, intubation, and mechanical ventilation. Okay, so these are the things that you should do in basic life support, and these things are sufficient enough to save your patient. Mind it. Okay, so this is the chain of survival. These are the things that you need to do to make the BLS successful. Okay, in the next lecture, what we can discuss is the pediatric things in pediatrics, what we can do. And subsequently also we'll learn more about the AEDs, and also we'll learn more about drugs which can cause similar symptoms, such as in drug intoxications, opioid overdose, which can cause similar symptoms. Okay, so now we'll move towards the practical.